All right, today we are opening up the pharmacist's playbook for what is, let's be honest, one of the most challenging areas of patient support, eating disorders. We're going to treat this as a practical guide for you to help you navigate these complex conditions right from your unique spot behind the counter. So let's just dive right in.
So picture this scenario. It happens all the time, right? A patient comes to the counter asking for laxatives. Again. And that little alarm bell in your head starts to go off. Something just doesn't feel right. That exact moment, that's a critical decision point. And how you handle it, it can make a world of difference. That's exactly why we've put this playbook together.
So here's our game plan. We've got 6 key plays. We'll kick things off with your crucial role and how to spot those red flags. Then we'll do a quick review of the 4 core disorders, dive deep into pharmacotherapy and some really effective counseling points, and then wrap it all up with a clear action plan.
Okay, first up, let's talk about your role. Because it is so much more than just dispensing. Your position on the front lines of healthcare makes you one of the most important and, honestly, one of the first lines of defense for these patients.
I mean, really think about it. For so many people, you are the most accessible healthcare provider they have, period. And that means you see the patterns that everyone else misses. Those frequent requests for laxatives, diuretics, maybe those sketchy weight loss supplements. That's not just a sale, right? It's a huge signal. You are the gatekeeper, and you are in the perfect spot to observe what's really going on.
So, what are you actually looking for? Let's get into the specifics of turning a simple observation into a meaningful intervention. It's really about tuning your senses to the clues your patients might be giving you, sometimes without even realizing it. You've got to look beyond just what they're buying. Are there physical signs? Scarring over the knuckles, that's the classic Russell sign. Or maybe you notice significant dental erosion when they're talking. And listen. Really listen to their other complaints. Dizziness when they stand up, heart palpitations, muscle weakness. These aren't just random symptoms. They are all pieces of a much bigger puzzle that you are perfectly placed to see.
Now that we know what to look for, let's get a really clear clinical snapshot of the 4 main eating disorders you're most likely to come across. Understanding the key differences here is absolutely essential to anticipating what your patients are going to need.
Okay, let's start with a really crucial distinction. Both bulimia nervosa and binge eating disorder involve binge eating. But the key differentiator, the thing that separates them, is what happens after the binge. With bulimia, you see those compensatory behaviors, like purging, to try and prevent weight gain. With binge eating disorder, you don't. That one difference is everything.
So here's how they all fit together in a nutshell. Anorexia nervosa is all about that severe restriction of energy intake. We just covered the key difference between bulimia and binge eating disorder. And then you've got ARFID, which is a whole different ballgame. With ARFID, the food restriction isn't about body image at all. It's driven by other things like a sensory aversion to food, a fear of choking, or just a total lack of interest in eating.
Okay, let's get into the heart of pharmacy practice, pharmacotherapy. We're going to break down the key medications, their goals, and of course, the essential counseling points you need to know for each of these disorders.
Now, this is absolutely crucial to understand for anorexia nervosa. There is no medication to treat the core disorder itself. The goal of pharmacotherapy here is totally supportive. We're targeting the secondary symptoms, things like delayed gastric emptying, constipation, or severe anxiety that are getting in the way of nutritional rehabilitation.
So, here's some of the key players you'll be working with. Olanzapine can really help reduce that obsessional thinking, but you have to counsel them that any weight gain is going to be pretty modest and slow. Domperidone is great for that awful feeling of fullness, but you absolutely have to monitor the QTC interval. Prucalopride, that's a fantastic tool for constipation, especially when you're helping a patient taper off laxatives. And zinc gluconate can help bump up the rate of weight gain. Just be sure to tell them to take it with food to avoid nausea.
Okay, before we go a single step further, we have to stop and focus on this. This is a non-negotiable red alert safety warning. Bupropion is absolutely contraindicated in patients with eating disorders, especially those who purge, because it dramatically increases the risk of seizures. This isn't a suggestion, it's an absolute no-go. Every single pharmacist has to have this burned into their memory. For bulimia, SSRIs are a real cornerstone, and the best evidence we have points to fluoxetine, often at higher doses, say around 60 milligrams a day. But here is the million-dollar counseling point. Does the medication actually have time to get absorbed? You have to ask about the timing of their dose compared to any purging behaviors, because if the timing is off, that drug could be completely ineffective.
Moving on to binge eating disorder, or BED, The whole goal with medication here is to break that cycle by cutting down on the binge frequency and those obsessive thoughts that drive it. And while you'll see SSRIs used, it's really important to note that lisdexamfetamine is currently the only agent that's officially approved by Health Canada for this specific indication.
So when you're counseling a patient, the contrast between the options is pretty clear. Lisdexamfetamine can reduce the binges, and it can help with weight, but you've got to prep them for side effects like insomnia, maybe some irritability. SSRIs, on the other hand, can help with those obsessive thoughts, but they're generally not going to do anything for weight loss, and of course they come with their own classic side effect profile, like GI issues or sexual dysfunction.
All right, we've got the drug facts down. Now let's talk about how we translate all that knowledge into an actual conversation. This is where you build trust. This is where you can make a real, tangible impact with your patients.
Remember that patient from the very beginning of our talk? Here is your 4-step game plan for that exact situation. 1. Build rapport. Approach with genuine concern, never with judgment. 2. Gently explain the long-term risks, what chronic use can do to their body. 3. And this is so important, stress a very slow, gradual taper over months, not days. Stopping cold turkey is a recipe for disaster and extreme discomfort. And 4. Offer a solution. Introduce alternatives like prucalopride to help their body normalize as they taper.
Let's run through a few more critical counseling pearls. Please always remind patients that purging can affect the absorption of any oral medication they're taking. Next, you have to correct the huge misconception that amenorrhea from anorexia means they can't get pregnant. They absolutely can. Also, warn patients who are starting nutritional therapy about the risks of refeeding syndrome. It's incredibly serious. And finally, always position yourself as part of their team, working together with their doctors and therapists for their health.
Phew, we have covered a ton of ground. So let's bring it all together into a clear, actionable summary. Think of this as your condensed playbook for the moment you walk back into the pharmacy.
Okay, let's recap the playbook, the Cliff Notes version. Number 1, be vigilant. Keep your eyes peeled for those OTC patterns. 2, differentiate. Know the core differences between the disorders. 3, know your pharmacology cold, especially that absolute bupropion contraindication. And 4, counsel proactively. Talk about the tough stuff, offer real strategies. That is how you make a tangible difference.
So I'll leave you with this question to think about. Armed with this playbook, you now have the tools not just to dispense pills, but to provide real understanding, safety, and crucial intervention. The next time a patient approaches your counter, you'll be ready to see the full picture and take the right next step.